My patients usually have 101 questions to ask when they first come to acupuncture, so I'm going to run through a few of the main ones with you today. Acupuncture is a part of Chinese medicine. It is a tried and tested procedure that has been practiced for thousands of years in China and the Middle East. 2.3 million treatments every year are given by British Acupuncture Council practitioners. In a typical acupuncture treatment, your practitioner will go through your medical history with you and also your presenting condition. The practitioner will also ask you quite a lot of detail about your lifestyle and your diet and your other signs and symptoms. They will also then take a tongue diagnosis by looking at your tongue and a pulse diagnosis from feeling your pulse. They will then discuss a treatment plan with you which will talk about dietary changes, lifestyle changes and also frequency of acupuncture. Acupuncture isn't painful. It feels like a tingling sensation. Sometimes there can be a heavy sensation on the point, but it is usually painless and no discomfort. Acupuncture needles are extremely fine, hair-like. Unlike hypodermic needles that doctors use, which are much thicker, these are very, very thin, like this one here is a typical size. Acupuncture doesn't hurt. You may feel the dull sensation or the tingling sensation, but it shouldn't feel like pain. Many people find acupuncture to be extremely relaxing. In fact, many people fall asleep during their acupuncture treatment. If you're frightened of needles, your practitioner can use acupressure instead, which is a technique where the points are stimulated using the fingers or thumbs, or other instruments such as rollers or probes can be used to stimulate the point without penetrating the skin. Acupuncture is extremely safe. In 2001, 2 studies were conducted to look at the safety of acupuncture, and those studies showed that there were only adverse side effects in 1 in 10,000 acupuncture treatments, which is very low. In a government-backed pilot study, GPs sent their patients to complementary therapists, including acupuncturists. Half of GPs reported a reduction in the need for medication and painkillers, and 81% of patients reported an increase in their health and well-being. Acupuncture is very safe. It is safe for babies and for children and for pregnant women, and it integrates very well with conventional Western medicine. Being a member of the BXC ensures excellence in education, safe practice and professional conduct. All members of the BXC have undergone extensive training in traditional acupuncture and anatomy and physiology and Western medicine. There is a substantial body of evidence to support that acupuncture is a safe and effective treatment. If you go to the British Acupuncture Council website, you will find briefing papers and research papers available there. The amount of sessions that you will need will vary depending on the condition and the amount of time that you've suffered from it. This will all be discussed at your initial consultation, but to give you an example, initially you may need 6 treatments with a review at the end. For ongoing conditions, you may want to return monthly for acupuncture. I think it's a good idea to let your doctor know that you're receiving acupuncture or any treatment. Some acupuncturists will write to your GP or your consultant to let them know of your treatment. Acupuncture cost varies quite a lot depending on the overheads of the acupuncturist. The best thing to do is to phone around several acupuncturists in your neighbourhood to see what the average cost is. Unfortunately, acupuncture isn't widely available on the NHS, although many GP surgeries now do have complementary therapies, and some of those will be acupuncture. And many private healthcare providers will cover acupuncture now.